Hello, my name is Dr. Rajiv. Welcome to my education channel, Surgery and Orthopedic Education. Today, I have a general surgery lesson for you, that is, basic concepts in homeostasis and basic concepts in milieu interior. Please subscribe to our channel if you have not subscribed yet, and don't forget to give it a like at the end if you find the video useful. So, let's not waste time anymore and start right now. In the 18th and 19th centuries, a series of eminent scientists laid the foundations of our understanding of homeostasis and the body's response to injury or surgery. In 1865, French physiologist Claude Bernard laid the foundation of homeostasis and the response to injury. He coined the term milieu intérieur, which means a constant interior bodily environment. He postulated that the milieu intérieur is the primary condition for freedom and independence of existence. The constancy of the milieu intérieur or homeostasis allows for the independence of organisms. The complex homeostatic responses maintain this internal constancy, that is milieu intérieur, and promote the elements of healing and repair. The word homeostasis was coined by Harvard physiologist Walter B. Cannon in 1926. He described and extended Claude Bernard's milieu intérieur concept and popularized it in his highly successful book, The Wisdom of the Body. He wrote that complex homeostatic responses involve the brain, nerves, heart, lungs, and kidneys to maintain the body's internal constancy or milieu intérieur. Elements of homeostasis. If something must be maintained in the body constantly within a normal range, there must be a control system or a processing unit. Therefore, the homeostatic system in our body consists of four components: signal or a stimulus, detector or sensor, processor or control center, and effector or target tissue. The injury works as a signal or a stimulus. Efferent or sensory nerves work as a sensor or detector of the injury, which send these signals to the processor in the brain. The hypothalamus is the main processor unit that regulates the events of homeostasis. To maintain homeostasis, this responds to the changes in the stimulus received from the sensor by sending signals to the effectors. Effector is either the cell, tissue, or an organ that responds to signals from the processor, producing a response to the stimulus in order to maintain constancy. For example, after trauma, the liver cells or effectors produce more glucose through gluconeogenesis to raise blood glucose levels. This signal detector processor effector system of homeostasis works in a negative feedback loop. The idea of homeostasis is valid only for normal physiology and mild to moderate injuries. In the modern world, this concept does not hold well for major injuries and severe sepsis or for the injured patient who would have died without artificial organ support or resuscitation. In these patients, the classical homeostatic control system, which is a signal detector processor effector system or a stimulus sensor control effector system, regulated by a negative feedback loop, is not effective. Here, an open loop system operates, where only through a medical or surgical intervention the loop can be closed and the primary abnormality can return to the classical homeostatic process. A short summary can be as follows. Homeostasis is the foundation of normal human physiology. A stress-free perioperative care preserves homeostasis following elective surgery. Classical homeostasis does not follow severe trauma or sepsis. Resuscitation, surgical intervention, and modern ICU-based critical care may return the critical condition back to classical homeostasis once again. As a result of the modern understanding of the metabolic response to injury, in elective surgical practices, we try to blunt the classical homeostatic response by minimizing the primary injury through minimal access surgery and a stress-free perioperative care. In emergent conditions, the presence of severe tissue trauma, critical sepsis, and or hypovolemia often compound the primary insult. Then we augment artificially the homeostatic responses through surgical intervention and resuscitation. For example, through surgical treatment of major abdominal sepsis or by providing organ support in ICU respectively. These modern interventions close the open loop and bring the patient back to a situation in which classical homeostasis can operate to achieve a return to normality.